Am I audible, guys? Am I audible? Okay. So, welcome to this FMGE Sprint. Okay, I'm Dr. Murugan, your meded PSM teacher. So, we'll discuss this 100 points, golden 100 points about this PSM for this upcoming FMGE exams. Okay, fine. So you can chat it in the group in the box. You can chat it. Okay, fine. Now prevention of emergence of risk factors. What is this? I'm not going to discuss in question answer format. Okay, I'm going to discuss more in terms of key points. I'm going to discuss key points. Okay, key points I will discuss. Okay, you can put it in the chat. You can put it in the chat. Okay, fine. Now just message it. If I'm audible means that's fine. Okay, fine. So yes, prevention of emergence of risk factors. What is this? Prevention of emergence of risk factors, that is before risk factors. This is primordial prevention. This is before risk factors, primordial prevention. Okay, fine. Now preventions of development of disease. Prevention of development of disease means the risk factor is there, so you are going to do prevention before the development of disease. This we call it as, yes, primary prevention. Primary prevention. Okay, fine. Action that halts the progression of disease. That means disease have started. Okay, what type of prevention is this? You can put it the answers there. Action that halts the progression of disease. What is it? This action, that means disease have already started. This we call it as secondary prevention. So before the risk factors, primordial. Before the disease, primary. Disease have started, we are trying to stop it at an early stage. Okay, that is secondary prevention. Okay, now so we have certain modes are there to achieve these modes of prevention. Okay, how many modes are there, okay, for achieve this prevention? So yes, you can answer it in the group. Yes, fine. So we have 5 modes are there. Okay, health promotion, specific protection, early diagnosis and treatment, disability limitation, rehabilitation. So chemoprophylaxis is an example for what? So vaccination, chemoprophylaxis, okay, or example for which mode of intervention? Okay, so these are mode for specific protection. Okay, specific protection, that is specific protection, that comes for primary prevention. That belongs to which level of prevention? Primary prevention. So chemoprophylaxis, vaccination, okay, that comes in specific protection, that primary prevention. For secondary prevention, what is the mode of intervention we have? Secondary prevention is early diagnosis and treatment. For secondary prevention, what we have is early diagnosis and treatment. Okay, fine. Now, so these are some of the points regarding prevention, guys. Okay, fine. Now, okay, we'll go to the next slide. What are the components of PQLA? Important areas we are discussing here. What are the components of PQLA? Yes, some of you can post it there. Yes, it is made up of 3 parameters. ILL1, infant mortality rate, literacy rate, and third one is life expectancy at age 1. Okay, that is PQLA, physical quality of life index. Infant mortality rate, literacy rate, life expectancy at the age of 1. Maximum, what is the scale for this? Scale is between 0 to 100. Okay, where 0 is the worst performance, 100 is the best performance. Okay, fine. What about HDA? What about HDA? Okay, what about HDA? Human Development Index. It is made up of 3 parameters. Okay, one is what? Life expectancy at birth. Life expectancy at birth. Yes. Second, what is it? Per capita income. Per capita income. Third, knowledge. Okay, knowledge in terms of mean years of schooling and expected years of schooling. So knowledge in terms of mean years and expected years of schooling. The scale is between 0 to 1. India is currently having 0.645. Okay, so India is currently 0.645. So it comes in which level? Medium HDA country. India comes in medium HDA country. Some countries were taken as standards. So what is this? Life expectancy. Which country is taken as standards? Japan. Japanese people having the longest life cycle. Okay, life expectancy. Per capita income, that is Qatar. Per capita income is Qatar. Okay, fine. Next we'll see DALI. What about DALI? Okay, what is DALI? DALI indicates what? DALI means disability adjusted life years. It includes two things: years of life lost plus years of life lived with disability. Okay, last year we had a question, NEET exam also. The years of life lost and years of life lived with disability. And this years of life lost is premature death. Premature death. This was also a recent question. Okay, that comes in DALI. So DALI indicates what? DALI indicates what? DALI indicates disease burden. Okay, it indicates disease burden. Okay, DALI indicates disease burden. Okay, are you guys able to follow it? Okay, put it in the chat box. We can discuss. Okay, I want to give a little bit more content, so I'm just going in a pace. Okay, if you have any difficulty, you just let me know. Okay, fine. So years of life lost and years lived with disability. Okay, fine. Next. What is case fatality rate? Case fatality rate. What is case fatality rate? Anyone? What is the case fatality rate? Indicates first question. What is the case fatality rate? Indicates. Second, what is the formula for it? What is the formula for it? Case fatality rate indicates what? Yes, it indicates virulence. Okay, virulence. I want to find out the case fatality rate for COVID. So what comes in numerator? What comes in denominator? Okay, number of COVID deaths. Number of COVID deaths by total COVID cases. Okay, total COVID cases multiplied by 100. Tell me a condition which is having 100% case fatality rate. Condition having 100% case fatality rate. 100%, that is rabies, guys. Rabies. Okay, this is virulence. Virulence is a recent question. Okay, what does it indicate? Virulence. Okay, fine. Now, what is secondary attack rate? Okay, our target is that at least some 5 to 10 questions should come from whatever we are discussing in this FMGE exam. Okay, fine. So at least 10. Okay, let us hope. Secondary attack rate, what does it measure? It is a measure of communicability. Okay, it is a measure of communicability. Secondary attack rate is a measure of communicability. So communicability starts from where to where? Okay, so communicability, number of new cases, okay, within one incubation period by total number of susceptibles, okay, among exposed, okay, multiplied by 100. Number of new cases by total number of susceptibles among exposed. Okay, secondary attack rate is a measure of communicability. Okay, communicability, and case fatality rate is a measure of virulence, and 100% case fatality rate is there with for rabies. Okay, fine. Now, next let us see about case control study. The case control study will start from where to where? Yes. Okay, exposure to outcome or outcome to exposure? You can put it in the chat box, guys. Case control study starts from where to where? Exposure to outcome or outcome to exposure? Case control study starts from outcome to exposure. Okay, outcome to exposure. Smoking and lung cancer means it starts from lung cancer to smoking. Lung cancer to smoking. That is why it's called as what study? Case control study. It's called as what study? Yes, it is called as retrospective study. Retrospective study. What you can find here in a case control study? What you can find? You can find odds ratio. Odds ratio. Okay, odds ratio. You can find odds ratio. Odds ratio equal to 1. equal to 1 means no association. Odds ratio equal to 1 means no association between exposure and outcome. Odds ratio more than 1 means positive association. Odds ratio less than 1 means negative association. Negative association. Equal to 1 no association, more than 1 positive association, less than 1 means negative association. Okay, fine. So this many points if you know regarding case control study, that is fine. What is cohort study? Cohort study starts from where to where? Exposure to outcome or outcome to exposure? Cohort study will start from exposure to outcome. That is why it's called as what study? Prospective study. Okay, that is why it's called as prospective study. It starts from exposure to outcome. What you can find? You can find incidence. Okay, incidence means number of new cases. Second, you can find relative risk. Okay, relative risk. Okay, relative risk indicates strength of association. Okay, similar to odds ratio. It is similar to odds ratio. Relative risk. Yes. Equal to 1 means no association. More than 1 means positive association. Less than 1 means negative association. Okay. Third, what you can find here, attributable risk. Attributable risk. Okay, attributable risk. Okay. Okay, smoking and lung cancer 90%. Okay, it tells us percentage of disease. Okay, attributed to exposure. Okay, how much percentage of disease is attributed to the exposure? Okay, fine. What does it mean? Smoking and lung cancer 90%. What do you mean by that? 90% of lung cancer is because of smoking. Okay, how much percentage of disease is attributed to the exposure? Okay, fine. So this is about cohort study. Cohort study. Famous cohort study that was asked in our exam is famous cohort studies Framingham heart study. Framingham heart study. I'm not giving in just listen. I'm not giving in a question answer format. Okay, so that we can have more content. Question answer means it will become very narrow. Okay, fine. Yes. Framingham heart study. Okay. RCT is what type of study? RCT is what type of study? Come on, yes. What is the answer? RCT. RCT is a experimental study. Experimental study. Okay. Second question. RCT comes in which phase of clinical trial? RCT is phase 3 of clinical trial. Phase 3. Phase 3. After phase 3, what will happen? Drug will go to phase 4. Phase 4, that will go to market. Okay, in market we do that post marketing. We do post marketing surveillance. We do post marketing surveillance. Okay, post marketing surveillance. After phase 3, in your exam question, after phase 3, the drug comes into market. So you do post marketing surveillance. In post marketing surveillance, what will you see? You will assess for long term side effects. Okay, you will assess for long term side effects. Post marketing surveillance. So you can assess for long term side effects. This is RCT. What about isolation and quarantine? What is isolation? What is quarantine? Come on, what is isolation? Isolation is done on whom? Quarantine is done on whom? When will you do the isolation and quarantine? Yes. What is isolation? What is quarantine? Come on, you can post it in the chat box. Isolation we do on patients. Isolation we do on patients. Quarantine we do on exposed people. Okay, exposed people. How long will you do the isolation? Isolation will be done during the period of communicability. Period of communicability. Quarantine, how long will you do? Quarantine you will do for maximum incubation period. Okay, for measles, the period of communicability is 4 days before the rash, 4 days after the rash. Okay, fine. Now, quarantine you will be doing for the maximum incubation period you will be doing. Suppose yellow fever, okay, somebody we thought that exposed yellow fever, the incubation period for yellow fever is 3 to 6 days. You have to quarantine for 6 days. Suppose for COVID, the incubation period is about 2 to 14 days. So you have to quarantine for 14 days. You have to quarantine. Okay. Next, we focus on vaccines, guys. What is open vial policy? We'll try to cover all topics. Open vial policy. Normally, 3 vaccines BCG, MR, JE should be used within 4 hours. Once you opened it, you have to use it within 4 hours. MR vaccine, if used more than 4 hours, what will happen? Anyone? Okay, MR vaccine, if used more than 4 hours, what will happen? It can cause, okay, greater than 4 hours means it can cause TSS, toxic shock syndrome, it can cause. Okay, fine. Now, all other vaccines in national immunization schedule, NIS is national immunization schedule, can be used for 4 weeks. Remaining all other vaccines. Okay, at birth what we give? At birth we give BCG, okay, OPV, we give hepatitis B, okay. So remaining all vaccines you can give up to 4 weeks you can give. Okay, fine. Now, that is open vial policy. This is TSS. This is recently asked. Okay, fine. What is AEFI? AEFI means adverse events following immunization. So what we have to remember is, one is VAP, vaccine associated paralytic polio. This happens because of type 3. Okay, this is VAP, okay, following OPV. Second, we have ITP, idiopathic thrombocytopenic purpura. Can anyone tell me ITP happens because of which vaccine? ITP or PDF. Okay, we can put it in the group, guys. We can put it in the group. ITP, okay, idiopathic thrombocytopenic purpura. Okay, it is associated with what? ITP. ITP is associated with MR vaccine. MR vaccine. Okay, fine. Now, next is DPT. DPT can cause persistent. Just listen. We can put it this PDF in the group. Okay, persistent inconsolable screaming. Persistent inconsolable screaming. Baby will be keep on crying. Baby will be keep on crying for more than 3 hours. Okay, screaming for more than 3 hours. And another one is that DPT can cause is hypotonic hyporesponsive episodes. Hypotonic and hyporesponsive episodes. Okay, these are some of the AEFIs, guys. These are some of the AEFIs. So VAP is because of type 3. VAP is because of type 3. Okay, fine. This is vaccine vial monitor. Anyone tell me which stage we can use, which stage we can't? You have to discard it. Okay, which stage we have to use it and which stage we have to discard it? This is stage 1 and 2. This outer dark circle, inner white square. Okay, stage 1 and 2 you can use it. Stage 3 and 4, as dark or more dark, discard it. Okay, discard it. Okay, can anyone tell me what is the most heat sensitive vaccine? Most heat sensitive. Okay, most heat sensitive, BCG after reconstitution. Okay, BCG after reconstitution. Most heat sensitive vaccine is BCG after reconstitution. BCG comes in powdered form and OPV. Okay, OPV. Now, some vaccines are free sensitive. The most free sensitive vaccine is hepatitis B. Okay, so what is the test to identify the frozen vaccine? Yes, the test what we have to identify frozen vaccine is shake test. Shake test to identify the frozen vaccine. Shake test. Okay, fine. What are the vaccines we can give up to certain age? Okay, what are the vaccines? The national, I hope that you know the national immunization schedule. This is not the class to discuss that. So there are certain vaccines up to 1 year, not more than 1 year. You should not give this vaccine. BCG, not OPV, BCG. Okay, hepatitis B, pentavalent. Okay, pentavalent, and IPV, Rota, PCV. These vaccines you should not give more than 1 year of age. Okay, BCG, hepatitis B, pentavalent, IPV, Rota, and PCV. So we should avoid this vaccine more than 1 year of age, guys. Okay, fine. Now, some vaccines you can give up to 5 years. Up to 5 years is MR, OPV, and vitamin A. 7 years is DPT, and 15 years is JE. JE vaccine you can give up to 15 years. So these are the vaccines you can give. Some age limit we have, and under national immunization schedule, some vaccines you can give beyond certain, you cannot give beyond certain age. Okay, so BCG, hepatitis B, Penta, IPV, Rota, PCV you should not give more than 1 year of age. Fine. Next we can go into screening topic, as we try to cover every topic. What is lead time? What is lead time? Past exam question in your FMGE exam. What is lead time? Lead time is the time between first possible point of detection to usual time of diagnosis. Okay, this we call it as lead time. This time. Okay, the time between first possible point and usual time of diagnosis. This is lead time. Lead time. First possible point and usual time of diagnosis. Okay, fine. Now what is sensitivity? The sensitivity means what? Ability of the test to identify whom. Yes, you can put it in the chat box. Okay, so otherwise it will be like one-way traffic. Come on, yes. What is sensitivity? Ability of the test to identify whom? Yes, ability of the test to identify true positives. What is the formula for it? Numerator is true positives, denominator is true positives plus false negatives multiplied by 100. The ability of the test to identify true positives. Okay, that is diseased people. Specificity. What is specificity? Ability of the test to identify true negatives. Okay, true negatives. That is, denominator is true negatives. Yes, excellent. Please continue. Denominator is true negatives plus false positives multiplied by 100. This is specificity. Formula at least we should know. Okay, ability true positive. This is diseased. Sensitivity is diseased people. Specificity is non-diseased people. Okay, fine. What is positive predictive value? Positive predictive value is the statement they will ask in the exam. Probability a person with positive test having the disease. Okay. Probability. It's a probability a person with a positive test having the disease. Okay, it deals with positive test results. Negative predictive value. Probability a person with negative test not having the disease. Statements also I have given. Formula I will write. So numerator is true positive, denominator total positives, guys. Okay, true positives plus false positives. Okay, false positives. Negative predictive value. Numerator is true negative, denominator is total negatives. Okay, total negatives. Okay, fine. This denominator is total negatives. Okay, fine. Now, what is prevalence? I want to remember prevalence is directly proportional to positive predictive value. This is a case statement. Okay, in your exam few years back, this question was there. What is the relationship between prevalence and positive predictive value? More the prevalence, more the positive predictive value. Okay, fine. Yes. Okay, answer this. What is this? Chicken pox. What are the key features regarding chicken pox rash? What are the key features regarding chicken pox rash? Yes. Yes. Smallpox we need not to know. Okay, so this is regarding chicken pox. It is centripetal rash. Okay, what else? Pleomorphism. Okay, pleomorphism. Pleomorphism. Printed notes, it's getting ready, doctor. Okay, it will be given as early as possible. Okay, timing it's corrected, it is on the process. Okay, fine. Now, centripetal rash. What is pleomorphism? Okay, what is pleomorphism? Pleomorphism is what? Yes, all stages of rash you can see. Dewdrop appearance will be there. Dewdrop appearance. Okay, only characteristic features we can see. Centripetal rash, pleomorphism, dewdrop appearance will be there. Okay, that is chicken pox. Most common late complication. Okay, late complication following chicken pox is herpes zoster. Okay, herpes zoster. Late complication is herpes zoster. Okay, fine. Now, what about this one? This is asked in NEET exam also. What is this? Can anyone tell me what is this picture? Yes, this is what? Small bluish white lesion. These are called as Koplik spots. Okay, that is pathognomonic of what? Measles. Pathognomonic of measles. So when it will appear? 1 to 2 days before rash. Okay, 1 to 2 days before rash. Koplik spots 1 to 2 days before rash. What type of rash you will get? Maculopapular rash. Okay, maculopapular rash. Complications can happen. The most common complication is, yes, most common complication is otitis media. Most dangerous is, yes, most dangerous is what? Most dangerous is, what we have is pneumonia, guys, pneumonia. Okay, Koplik spots, and most dangerous is pneumonia. This is about measles, guys. This is about measles. Okay, this year we had this Koplik spots as a NEET exam question. Okay, fine. What are the characteristics of congenital rubella syndrome? Okay, come on, can you tell me? Yes, yes, please answer it. What is congenital rubella syndrome? Okay, try it. If the mother is getting infected with rubella during the period. Okay, first, what are the components? One is sensory neural hearing loss. Sensory neural hearing loss. Second, PDA, patent ductus arteriosus. Okay, PDA, patent ductus arteriosus. Third is cataract. Okay, sometimes the patient may have VSD or pulmonary artery stenosis also may be reported. If the mother is in which trimester, baby can develop this. Mother is in which trimester? Okay, the mother is in 0 to 16 weeks. Okay, they can go for congenital rubella syndrome. 16 to 20 weeks of gestation. 16 to 20 weeks of gestation, they can develop only deafness, guys. Deafness. Okay, more than 20 weeks means no abnormality. More than 20 weeks means no abnormality. Okay, fine. This is congenital rubella syndrome. Okay, fine. Next. What is this? What is this? Yes. This is diphtheria. Okay, this is diphtheria. Agent is Corynebacterium diphtheriae. Okay, this is diphtheria. Agent is Corynebacterium diphtheriae. Okay, what is the source is carriers, guys. Carriers. Key point is that source is carriers. Okay, so what is the treatment? Is the treatment we have to provide penicillin plus antitoxin. We have to provide penicillin plus antitoxin. We have to provide penicillin plus antitoxin. The antitoxin we have to provide 20,000 to 1 lakh international units we have to provide. Antitoxin plus penicillin. And for carriers, what is the drug of choice? For carriers, the drug of choice is erythromycin. Okay, what is the drug of choice for carriers? That is erythromycin. Erythromycin. Okay, fine. Now, Am I clear? This is diphtheria, guys. Diphtheria. Okay, so membranous patch will be there. Okay, along with bull neck appearance will be there. It's a medical emergency because the membranous patch produces toxin. It can cause myocarditis. Okay, fine. Next. Okay, this is the logo for TB. So I want you to tell me, okay, what are the symptoms for TB and what is the investigation you want to do and what is the treatment. Okay, symptoms for TB is cough more than 2 weeks. If anyone you are seeing, okay, this is National TB Elimination Program. So our goal is to eliminate TB by 2025. The goal is to eliminate TB by 2025. So cough more than 2 weeks, fever more than 2 weeks. So you have to rule out TB. Other symptoms are also there. Okay, hemoptysis is there, weight loss is there. So you take 2 sputums plus you take chest X-ray. Okay, chest X-ray. Now what is your diagnosis? So if it is positive, okay, if it is positive means TB, guys. Both sputum are negative, X-ray looks positive, then we should go for a next test that is called as CB-NAT. This is asked in NEET exam. If both sputum are negative but X-ray looks positive, CB-NAT, cartridge-based nucleic acid amplification test. Now, if it is positive, what is the treatment? If CB-NAT is positive, the current treatment for TB is 2-HRZE and 4-HRE. So 2 months of all drugs you have to provide: isoniazid, rifampicin, okay, pyrazinamide, ethambutol, and 4 months HRE. Okay, fine. Now what is MDR TB? What is XDR? What is pre-XDR? MDR TB means they are resistant to HR resistance. Okay, they are resistant to HR. Okay, isoniazid and rifampicin. Pre-XDR. Pre-XDR means they are resistant to MDR and resistance to fluoroquinolones. Fluoroquinolones, yes, MDR as well as they are resistant to fluoroquinolones. Okay, pre-XDR. What is XDR? Okay, these things will be there. Okay, these things will be there additionally. That is MDR, resistance to fluoroquinolones, plus they will be resistant. They have to be resistant to, okay, bedaquiline. Okay, bedaquiline and linezolid. Okay, they have to be resistant to bedaquiline as well as linezolid, bedaquiline and linezolid. Okay, XDR TB means resistant to MDR, HR resistance should be there, resistant to fluoroquinolones plus resistance to bedaquiline and linezolid. Okay, fine. Pre-XDR, this is as per the new WHO guidelines. So it says that pre-XDR is MDR plus resistant to fluoroquinolones. Okay, fine. What is annual parasite incidence? Okay, what is annual parasite incidence? Using this, we are going to classify the area is high risk or not. Okay, API less than 1. Less than 1 per thousand. Less than 1 per thousand is the criteria for elimination of malaria. Elimination of malaria in all districts of India. API should be less than 1. What is ABR, blood examination rate? It indicates operational efficiency of the program. Okay, operational efficiency of the malaria control program, whether the program is working properly or not. To say it as good, it should be more than 10%. Okay, annual blood examination, to say it as good, it should be more than 10%. Recently asked question, what is infant parasite rate? Percentage of infants with parasite in the blood. This indicates recent malaria transmission. This indicates recent malaria transmission. What is infant parasite rate means? Percentage of infants with parasite in the blood. Okay, so this is a recent question. Okay, recent malaria transmission. One more is there, what we call it as spleen rate. What is the use of spleen rate? Spleen rate will talks about endemicity of the disease. Okay, endemicity of the disease. Spleen rate talks about endemicity. Okay, so am I clear? No, fine. Okay, can you tell me the treatment for rabies, guys? Can you tell me the treatment for post-exposure prophylaxis for rabies? What is this essence regimen? What is this updated Thai regimen? What is essence and what is updated Thai regimen? Okay, essence regimen, yes. So we are going to provide how many days? Come on, you can post it here. Essence regimen, how many days? Yes, essence regimen 0, 3, 7, 14 and 28 days. Okay, how much ml we are going to provide and what is the route essence regimen? Intramuscularly 0.5 ml. Okay, intramuscularly 0.5 ml you are going to provide essence regimen, and category 2 and category 3 you will give. Okay, category 2 means you will give only vaccine. Category 3 means you will give what else you will give? You will give immunoglobulins also. The second one is updated Thai regimen. Okay, updated Thai regimen. This is given 0, 3, 7 and 28 days. You are going to provide intradermally 0.1 ml. Intradermally you are going to provide 0.1 ml you are going to provide. Okay, 0, 3, 7 and 28 days. Okay, fine now. So if after 10 days animal healthy means you can stop the drug. You can stop the vaccine. Okay, pre-exposure. Okay, you are at risk of getting dog bite or any other bites. So you can provide on these days 0, 7, 21 or 28 days. 0, 7, 21 or 28 days. This is pre-exposure prophylaxis. Pre-exposure. Post-exposure already vaccinated. In the past you have been vaccinated. Again you want revaccination. Okay, so again you are bitten by a dog. So revaccination. So what is this? Post-exposure already vaccinated means yes. So you can provide on these days 0 and 3. 0 and 3. So which category you will give immunoglobulins? Which category you won't give immunoglobulins? Yes, you can put it there. Category 2 only vaccine. Okay, only vaccine. Category 3 you have to provide ARV plus immunoglobulins. Category 3 you have to provide ARV plus immunoglobulins. Okay, fine. Now, so am I clear? So this is about the regimen for dog bite, rabies, pre-exposure, post-exposure and already vaccinated. Okay, fine. Next. What are the points related with yellow fever vaccination, guys? What is yellow fever vaccination? So yellow fever, first point is that you already know that it's not present in India. So what is the vaccine we give? The vaccine we give is 17D vaccine. Is 17D vaccine. Okay, fine, 17D. So it is given, okay, at the designated places we give, and the once you taken the vaccine, they will be provided yellow fever certificate. They will be provided international yellow fever certificate. They will be providing, and so for this certificate, what is the validity of the certificate? The validity starts from 10 days to lifelong. Okay, validity starts from 10 days to lifelong. Once you have taken the vaccine, the validity of the certificate will be the 10 days to lifelong. Can anyone tell me what is I strategy? What is I strategy? Okay, what is I strategy means what? Anyone? What is? Yes, the WHO specifically uses this strategy called as elimination of, okay, yellow fever epidemic strategy. Okay, elimination of yellow fever epidemic strategy, that is I strategy. Okay, fine. These are the points we should know regarding yellow fever, guys. So yellow fever, there should not be any breeding place in and around seaports and airports for 400 meters. And no house should have a breeding place for Aedes mosquito. What mosquito transmits? Yes, yellow fever is by Aedes mosquito. Okay, fine. So Kala Azar. Next we can go into Kala Azar. Few points related with Kala Azar. Can you tell me what is the vector for Kala Azar? Yes, you can put it there in the chat box. What is the vector? Yes, Kala Azar is sandfly. Next question. What is the investigation for Kala Azar? Patients presenting with fever, hepatosplenomegaly, especially in the certain parts are there. Uttar Pradesh, Bihar, West Bengal, Jharkhand. These are the 4 endemic states. So if anyone coming here, so what is the investigation is RK39 kit. Okay, RK39 kit. What is the drug of choice for Kala Azar? Drug of choice. Okay, if anybody is found to be positive, so we have to start with liposomal, okay, amphotericin B. Okay, liposomal amphotericin B. This is the drug of choice. So I make clear. So Kala Azar, sandfly, RK39 kit, guys. Okay, fine. Next. Excellent, excellent, Dr. Shalu. Yes. Next question. What is paucibacillary leprosy? What is multibacillary leprosy? Pauci and multi. So we can diagnose leprosy clinically. Patient comes with hypoanesthetic and hypopigmented patches. 5 or less than 5 lesions. That is paucibacillary. Okay. More 6 or more than 6 lesions. That is multibacillary. So what is the treatment? Our country treatment alone we will see FMGE exam. So we have this rifampicin once a month. Okay, once a month. And we have dapsone, we have daily. Okay, dapsone we have daily. What about multibacillary? Can you tell me what is the treatment for multibacillary? Okay, what is the treatment? So we have this will come here. Rifampicin once a month. Okay, dapsone daily. What is the third drug? What is the third drug? Is the third drug what we give is clofazimine. Okay, clofazimine. This also will give daily, guys. Clofazimine will give daily. Okay, so rifampicin once a month, dapsone daily, and third drug is clofazimine. How long will you give? Okay, for paucibacillary we have to provide it for 6 months. For multibacillary we have to provide it for 12 months. The duration of treatment is 12 months. Okay, fine. So we have for Nikshay. Okay, well, Nikshay is associated with what? Nikshay is associated with TB. For leprosy, we have an online portal is there called as Nikus. For TB, we have Nikshay. Okay. What is the treatment for HIV, guys? Okay, anyone, the patient is coming there, okay, from ICTC. The patient is diagnosed as having HIV positive. We are referring the patient to ART center. What is the treatment, current treatment for HIV? The current treatment is, okay, TLD. Okay, what is TLD? Tenofovir, lamivudine plus dolutegravir. Okay, you have to start immediately. Once you found a case of HIV, immediately lifelong ART. Okay, so tenofovir, lamivudine and dolutegravir immediately for lifelong ART. Lifelong ART we have to provide. What second is, what is this PPTCT? Prevention of parent to child transmission. Okay, for them also the same concept. For prevention of parent to child transmission, for them also the same concept. Tenofovir, lamivudine and dolutegravir, immediately lifelong ART. Immediately lifelong ART we have to start. If a pregnant woman is positive, you have to start tenofovir, lamivudine, dolutegravir plus we have to provide nevirapine syrup for the baby. Syrup for baby. For 6 months we have to provide. Okay, nevirapine syrup we have to provide. Tenofovir, lamivudine and dolutegravir. Nevirapine syrup we have to provide it for 6 months, 6 weeks, guys, not months. 6 weeks. Right, next. Syndromic approach, multiple times asked question. What is the name of the clinic for STD? They renamed as Suraksha Clinic. Okay, fine, Suraksha Clinic. Okay, so we have this syndromic approach. Okay, the syndromic approach, we have kits are there. Okay, this is gray color kit. We can give it for urethral discharge, cervicitis, anorectal discharge. Okay, green color we can give it to vaginitis. Blue color you can give it to GUD, genital ulcer patient. A patient coming with genital ulcer. And red color we can give it to painful GUD, genital ulcer disease. GUD means genital ulcer disease. And yellow color we can give it lower abdominal pain. LAPA will write lower abdominal pain. And black color we can give it to inguinal buboes. Inguinal buboes. Okay, so black color we can give it to inguinal buboes. Okay, this is syndromic. Okay, syndromic diagnosis. Okay, syndromic management of a person with STD, guys. STD, and we rename the clinic as Suraksha Clinic. Okay, Suraksha. This was asked in your exam once. Next, let us see something related with steps approach. What is this steps? Steps is related with what? Steps is related with NCD risk factors survey. NCD risk factor survey. This is asked last year in NEET exam. So NCD risk factor, first step, you ask questionnaire regarding NCD risk factor, smoking, alcohol, those things. Second step is physical measurements. Okay, you do physical measurements. Okay, fine. Okay, you check BMI, height, weight, okay, blood pressure. Third is biochemical measurements. Okay, third we have is biochemical. Okay, fasting blood sugar, cholesterol and all. Okay, this is steps by NCD risk factor survey. Rule of halves. Can you tell me it is associated with what? Yes. Rule of halves. Herpetic. Herpetic is red color. Painful genital ulcer disease. Herpetic. And rule of halves is associated with hypertension. In a community, okay, hypertension is a highly asymptomatic disease. Only 50% will know that they are having hypertension. Okay, so that is rule of halves is associated with hypertension. And tracking is asked this year in NEET, that is also hypertension. Okay, so those low blood pressure people tend to be low. Okay, and high blood pressure children will develop hypertension in future date. Okay, so what is the use? Tracking is identifying children at risk of hypertension in future date. At risk of hypertension in future date. In future, that is tracking. You follow the children, identifying children at risk of having hypertension in future date. If the children is having high blood pressure, you can start the preventive measures early. You can start. Okay, fine. All our questions recently asked in NEET or NEXT or FMG, where it is not NEXT, NEET or FMG, TFR. What is TFR? Okay, it's multiple time asked question, demography chapter. TFR is that total fertility rate. Okay, it indicates average number of children. This is the most popular indicator. Average number of children to a woman. Target is should be less than 2.1. We have achieved it actually. The target is TFR target is less than 2.1 and we have achieved it. And this is the most important indicator. This question also was asked. What is NRR? Okay, NRR is number of girl children born to a woman. Girl children, okay, born to a woman based on current fertility and mortality. You are trying to predict how many girl children a woman will have in her lifespan. Okay, So based on current fertility and mortality. So NRR, what is our target? Okay, what is the target NRR? NRR should be 1. So both are questions. TFR target is less than 2.1 and the target for NRR is 1. Net reproductive rate, number of girl children born to a woman, that is, okay, NRR should be 1. Fine. Next, IUCD. Okay, IUCD, what is the copper T we use in the program? Copper T uses copper T 380A, guys. Copper T 380A. What is 380? Surface area of copper in square millimeter on the device. Okay, surface area of copper in square millimeter on the device, that is copper T. Okay, fine. Apart from this, what else we have? Copper T 375 we have. 380 we can use for 10 years and 375 we can use it for 5 years. 5 years we can use. Okay, fine. Surface area of copper in square millimeter on the device. Okay, fine. So what is Mala D and Mala N? Mala D, okay, which one is free of cost here? Yes. Okay, both are OC pills. Okay, this one is free and this one comes in social marketing scheme. Okay, this one comes in social marketing scheme. Okay, Mala N is free of cost. So both will contain 21 hormonal pills. 7 iron tablets will be there. Okay, 7 iron tablets will be there. 21 hormonal pills and 7 iron tablets will be there. Mala D and Mala N. What is this? Yes, the image is there. You can remember this Antara. Antara is DMP, depot medroxyprogesterone acetate. Depot medroxyprogesterone acetate. Can you tell me? It is given 150 milligram IM injection 3 months once. Okay, this is Antara. Okay, 150 milligram IM injection every 3 months once it is given. This is DMPA, depot medroxyprogesterone acetate. Okay, fine. Next. What is this Sencroman? Sencroman is associated with what? Sencroman is, this comes under the trade name of Chaya. Okay, it's a non-steroidal oral contraceptive. Non-steroidal oral contraceptive. What does it contains? Okay, chemical that is present is called as ormeloxifene. Okay, ormeloxifene, that is a chemical that is present. Okay, fine. This is Chaya. We call it as Chaya. Okay, fine. Next. What is this emergency contraception? The program what we use is called as Easy Pill. This is Easy Pill. Okay, 0.75 milligram of levonorgestrel. Okay, 0.75 milligram of levonorgestrel. 2 tablets you have to give within 72 hours. Yes, within 72 hours of unprotected sex as an emergency contraception you can give. What are the other methods you can give? Recently also asked. Other methods what you can give is that, okay, second is you can give OC pills you can give, that is 72 hours. Third, high estrogen dose OC pills. Okay, high estrogen dose OC pill, that is also 72 hours you can give. Third, what you can give, fourth you can give is mifepristone RU486. This is mifepristone, that is also you can give for within 72 hours. And fifth is what you can give is called as IUCD. You can give it for 5 days. 5 days. So this is emergency contraception, guys. Emergency. Recently we had a question on emergency contraception. All these methods you can use it for how long? 72 hours. Only IUCD we can use it for how long? 5 days. 5 days. Next. Antenatal care. What is the minimum number of antenatal visits? Minimum, yes, anyone, minimum visits. Okay, what does our ministry says? What does what is that? WHO says the minimum number of visits for us is 4. Okay, and WHO recommends the visit should be 8, guys. WHO says that the minimum number of antenatal visit is 4 for 8, but our country, limited resource country, we say that minimum number of visit is 4. What is IMR? Okay, so recently we had a question, IMR. So infant mortality rate, okay, infant deaths, numerator is infant deaths, denominator is live births multiplied by 1000. What does it indicate? It indicates, need question, health status of the community. Health status of the community. Infant mortality rate indicates what? Health status of the community. Perinatal mortality rate. What does perinatal mortality rate indicates? Okay, perinatal deaths. What is perinatal deaths? Means stillbirths plus early neonatal deaths. So this indicates pregnancy wastage. Perinatal death indicates pregnancy wastage. Okay, fine. Under 5 mortality rate indicates social development and well-being. Social development and well-being. Under 5 mortality rate indicates social development and well-being. Okay, fine. Now MMR. Okay, MMR. I think we had last exam we had a question. Maternal deaths. What is a maternal death? Numerator is, this is MMR, guys. Maternal mortality ratio. Numerator is maternal deaths. Denominator is live births. What is a maternal death? Maternal death means women died during pregnancy or delivery within how many days of delivery? Okay, within 42 days of delivery. Within 42 days. 42 days. That is a maternal death. Okay. Women died during pregnancy or delivery within 42 days. That is postpartum period. So next is what is the most common cause of maternal death in India? Is the most common cause is PPH, postpartum hemorrhage. Postpartum hemorrhage is the most common cause. Okay, fine. Okay. This is the growth chart, guys. This is the growth chart. So we have a separate growth chart for girls, separate growth chart for boys. Okay, fine. Now, so for this is median. From median minus 2 standard deviation, from median minus 3 standard deviation. The child falls between this is normal. Yellow color means okay, mild to moderate undernutrition. Mild to moderate undernutrition. Red color means severe undernutrition. Okay, normal, mild to moderate undernutrition. Red color is severe undernutrition. We have some other indicators. We have one such is that weight for age. Weight for age and weight for height. Okay, height. Both indicates acute malnutrition. Okay, acute malnutrition. Both indicates acute malnutrition. Height for age. Okay, height for age indicates what? Can anyone tell me what does height for age indicates? Just listen, guys. Okay, let's just listen. You will get maximum number of points. Height for age indicates what? Chronic malnutrition. Height for age indicates chronic malnutrition. Weight for age, weight for height indicates acute malnutrition. Height for age indicates chronic malnutrition. Okay, fine. Next. What is this logo for anyone? Yes, I already given. It is ICDS. Integrated Child Development Services. The main activity will happen the place called as Anganwadi, which will be for 400 to 800 population. Main activity. Okay, fine. Who will be there? Anganwadi worker will be there, and they will be providing supplementary nutrition. Supplementary nutrition. They will be providing food to the children. Okay, for 300 days in a year. Okay, pregnant mother, lactating mother. Okay, fine. So in this we have this health education will be provided rather than health education, nutrition education. Nutrition education will be provided. That was asked actually. Who will provide the nutritional education? That is Anganwadi worker. This year NEET question, that was it. Okay, nutrition education will be provided by Anganwadi worker. That is given by this nutrition education. We have this non-formal preschool education. All can happen here. Okay, what is this, guys? Come on, make the diagnosis. Yes, I'm trying to cover as much as possible. Okay, what is this diagnosis? Come on, yes. Yes, this is bite out spots. This is bite out spots. Okay, fine. What is the treatment? If you're finding a bite out spot, what is the treatment? The treatment is, okay, you have to provide days 0, 1 and 14 days. The image based question that was asked, days 0, 1 and 14 days. Okay, what is the treatment? So vitamin A you have to provide days 0, 1 and 14 days you have to provide. Okay, fine. The most richest source of vitamin A. Okay, fine. Richest source. What is the richest source of vitamin A? That is halibut liver oil. Second is cod liver oil. Okay, fine. Now the question in your exam is more than 1 year. More than 1 year we have to provide 2 lakh international unit. The question is that more than 1 year child malnourished. Okay, malnourished, more than 1 year child is malnourished, you can't give 2 lakh international units. Okay, so what you have to do is that you have to provide 1 lakh international units. Usually more than 1 year we have to provide 2 lakh, but the child is malnourished, we have to go with 1 lakh international units. Okay, fine. What is this? This is recently asked multiple time question. What is this? Yes, this is niacin deficiency. Niacin deficiency. What is this condition? Okay, it is common in maize eating population. Maize eating population. What is the symptom? Yes, what is this called as? They will have diarrhea, dementia and dermatitis. What is this called as? This we call it as dermatitis Castle's necklace. Okay, Castle's necklace. Okay, asked as an image based question in FMGE exam also. Okay, fine. Maize eating population, it is common. What is this one? Okay, what is this one? This is some type of dal that was asked. Yes, what is this one? Yes, this is kesari dal. Okay, consuming this kesari dal contains a toxin called as BOA, beta oxalate aminoalanine. Okay, this leads to neuroletharism. Okay, this leads to neuroletharism and it can be prevented by vitamin C prophylaxis. We can prevent it by vitamin C prophylaxis. Okay, both have been recent question. Vitamin C prophylaxis and the whole system, that is neuroletharism, both was asked as a question. Okay, fine. Next, some points related with chlorination, guys. Chlorination. What is the main disinfecting action? The main disinfecting action is because of okay, hypochlorous acid. Okay, hypochlorous acid. Main is hypochlorous acid. Chlorine, how much? What is the equipment that measures chlorine demand? chlorine demand is measured by Horex apparatus. Okay, Horex apparatus. Chlorine demand is by Horex apparatus. Okay, fine. Now, how much chlorine should be there? The minimum contact period. Okay, suppose a water is there in a tank, you have to put bleaching powder in it. The minimum contact period should be 60 minutes. Okay, minimum contact period should be 60 minutes. How much should be the residual chlorine should be there? Okay, residual chlorine should be 0.5 milligram per liter. Residual chlorine should be 0.5 milligram per liter. Okay, fine. This is chlorination. These are some of the key points related with chlorination. Solid and sewage disposal. We learn some points. Solid. Okay, solid waste disposal. The best one is called as controlled tipping. Controlled tipping. This is the best one if land is available. Okay, for camping purpose, we can go for deep burial. Okay, for camping purpose, we can go for deep burial. Sewage disposal, it should go to sewage treatment plant, then it should go for disposal. Sewage treatment. So how will you measure the strength of the sewage? Means, okay, liquid waste, okay, with excreta. And the second one is sullage. What is sullage? Sullage means, okay, liquid waste without excreta. Okay, without excreta. Okay, liquid waste with excreta, liquid waste without excreta, that is sullage. The best is controlled tipping, and second is camping. Camping we should go for deep burial. Okay, fine. Some program names. You tell me what is this program is for what? What is the name of the program? Is Labor Room Quality Initiative. Come on, you can put it in this chat box. Yes, what is the name of the program? Labor Room Quality Initiative is, okay, Lakshya program. What is the Healthcare Facilities Cleanliness Award? Okay, Healthcare Facilities Cleanliness Award is, yes. So we have this Kayakalp Award. Training healthcare workers on newborn resuscitation. Okay, rural areas we don't have enough doctors. So this program is called as NSSK, Navjat Sishu Suraksha Karyakram. Okay, fine. Next, child trafficking. Child trafficking is what? Prevention of child trafficking, women for child trafficking. Yes, it is Ujawala scheme. Okay, Ujawala scheme. Child screening and early intervention, RBSK, Rashtriya Bal Swasthi Karyakram. Just know the name. Outbreak identification. What is the name of the program? Outbreak identification is what? IDSP. Outbreak is IDSP. Okay, fine. Next. Promote institutional delivery. What is the name of the program? Institutional delivery. Yes, JSY, Janani Suraksha Yojana. Free transport for pregnant mothers. Okay, that is Janani Sishu Suraksha Karyakram. Okay, free transport is JSSK, Janani Sishu Suraksha Karyakram. This Niti Ayog. What is this Niti Ayog? One time as a full form in your exam was asked, what is Niti Ayog? Niti Ayog is National Institution for Transforming India. National Institution for Transforming India. STD, what is the name of the clinic? We already seen it today. Suraksha Clinic. Suraksha Clinic, STD. And free antenatal services to identify high risk cases. This is called as PMSMA program. Pradhan Mantri Surakshit Matritav Abhiyan. PMSMA, Pradhan Mantri Surakshit Matritav Abhiyan. And adolescent health. What is the name of the program? RKSK. Adolescent health. The name of the program is RKSK. Okay, RKSK. Adolescent health. The name of the program is RKSK. Fine, next. Full form of IDSP. IDSP means Integrated Disease Surveillance Program. IDSP means Integrated Disease Surveillance Program. IDSP. Next. ASHA. For what population we will have ASHA? For what population we will have ASHA? ASHA will be there for every 1,000 population 25 to 45 years. She should be married, widowed, or diverse. Okay, she should be married, widowed, or diverse. She should be between the age of she should studied up to 10th standard now. 10th standard. She should be the resident of the village. She should be the resident of the village. Okay, fine. This is ASHA. Okay, so she how much money she will get? So there is no fixed salary. What ASHA will get is performance based incentive she will get. Subcenter normally will be there for 5,000 population. Okay, hilly areas only 3,000 population. Subcenter will be the subcenter. Normally 5,000. Hilly areas what we get is 3,000 population. Now, so a subcenter who will be there? The main worker will be there, female health worker. And second what we have is male health worker will be the male health worker. Okay, female health worker, male health worker. What is the job responsibilities of male health worker? So female health worker, she will be doing antenatal care, intranatal, postnatal care she will be doing. So female subcenter, how many beds will be there? 1 to 2 beds will be there. Normal deliveries can happen. And the repeated question for male health worker is malarial surveillance. That is the job responsibility of male health worker, malaria surveillance. Okay, that is very characteristic of male health worker. Fine. Under PHC, what is PHC? We have a PHC, 4 to 6 beds will be there. And we have PHC, normal areas 30,000 population, hilly you have this 20,000 population, and every PHC will have 6 subcenters will be there. 6 subcenters. 6 subcenters will be there. This is the first level of contact of a doctor. In your exam, recent question. What is the first contact of doctor? First contact of doctor. First contact of doctors. Okay, fine. Now, so beyond above PHC, what we have is CHC. CHC will be there for 80,000 to 1.2 lakh population. Okay, 80,000 to 1.2 lakh population is CHC. Okay, fine. CHC, what will be the specialist will be the physician, surgeon, OGCN, pediatrician will be there. And every CHC we have 4 PHCs will have. Okay, this is the secondary level. Secondary level. Usually this level we have call it as first referral center, especially for delivery, cesarean section, first referral center. Okay, this may be the place. Okay, fine. Next. What are the waste you will put in yellow color bin? Okay, fine. Recently asked question we will see. Okay, anatomical waste, guys. Anatomical waste. Okay, placenta and any anatomical waste. Blood bags. Okay, blood bags, it should go to yellow color bin. Blood bags. Okay, what else? So drugs, actually drugs, expired discarded drugs. Okay, liquid chemical waste. Okay, liquid chemical waste or chemical waste. Okay, it should go to yellow color bin. Okay, white color bin, what will you put in white color bin? Is white color bin sharps. Okay, blades. Yellow color bin should go for incineration. Okay, incineration. Yellow color bin should go for incineration. Sharps, blade can go to white color bin. Fine. Red color bin, what will you put in red color bin? Yes, the red color bin, yes. So you can put catheters. Okay, gloves you can put, catheters you can put, gloves you can put, what? IV sets, anything rubber, plastics and tubes can come. Okay, IV sets, syringes without needles. Okay, red color bin. Blue color bin is vials, ampules, broken vials and ampules. If they are having with vaccine means, if vaccination session is there with vaccine means it should go to yellow color bins. But here it is vials, broken vials and ampules, and metallic body implants. Okay, recently asked one is pacemaker. Okay, pacemaker should go to blue color bin, guys. Pacemaker should go to blue color bin. Blue color bin. Okay. Okay, fine. Next. What is group discussion? What is demonstration? What is panel discussion? Okay, what is group discussion means 6 to 12 members, they sit and discuss. That is group discussion on a particular topic. Okay, so there should be a leader, should be there, note taker should be there. Okay, and a timekeeper. Okay, timekeeper. These are the some of the very effective method of health communication. These are effective method of health communication. Okay, this is group discussion. Group discussion. Next is what is demonstration. Demonstration will you use whenever you are teaching a skill. Teaching skill. For example, ORS preparation. I want to use ORS preparation. Then to teach that, demonstration can be done. Next. Panel discussion. Recently asked question in your exam. 4 to 8 experts. Okay, sit and discuss on a particular topic. Okay, so you can raise questions to them and they can answer. That's a panel, qualified people, and they will sit and discuss. So among themselves, and you can, as a participant, you can raise question. That is panel discussion. Okay, fine. Next. Okay, what is this, guys? Yes, it's an image-based question. What is this? Yes, this is sandfly. It transmits what? Kala azar. This is sandfly. It transmits Kala azar. Other disease also it transmits, but in India we want is this Kala, hairy insect. Hairy insect. What is this one? This mosquito sits with an angle to surface. What is this one? This is Anopheles, guys. This is Anopheles. Okay, only mosquito sitting with an angle. Okay, it transmits what? Malaria. It transmits malaria. Okay, fine. It transmits malaria. The next one is Culex. Culex exhibits hunchback. It transmits what? Filaria and JE. Okay, Aedes important one is dengue, chikungunya and Zika virus. Zika. Okay, Zika. Dengue, chikungunya and Zika virus. Okay, Aedes transmits. Okay, fine. Aedes is considered as tiger mosquitoes. Culex is considered as nuisance mosquito. Fine. Next. Regarding UNICEF, guys. Regarding UNICEF, what we should know is, okay, Gobi FFF. Okay, growth monitoring, ORS, breastfeeding, okay, and female literacy, food fortification, family spacing, that is done by UNICEF. Okay, so growth monitoring, ORS, breastfeeding, immunization, female literacy, and family spacing and food fortification. SIDA, International Health Agency, is associated with National TB Control Program. And DANIDA is International Agency, is associated with National Blindness Control Program. Blindness Control Program. Okay, Blindness Control Program. Okay, what is the theme for World Health Day this year? Okay, World Health Day, WHO's 7th April, we celebrate it as World Health Day. The theme for this year is, what is the theme? Yes, health for all. Health for all. That is a theme for this year, World Health Day. Health for all, that is the theme for this year. Last 2 slides, guys. Okay, fine. Name of the patients, it's given. What type of graph is there? This is time is there. Yes, this is time. This is called as line diagram. Line diagram. It shows trend of the event over a period of time. Okay, this is line diagram, guys. This is line diagram. Trend of the event over a period of time. Next, what is this one? Yes, this is okay. This is histogram, guys. This is histogram. What is histogram? Okay, this is used for quantitative data, and it talks about distribution of the data. Distribution of the data. Okay, this graph will tell you the distribution of the data. Okay, fine. Whether the data is normally distributed or not. Okay, cholesterol is there. Cholesterol is what data? Cholesterol is quantitative data. Okay, fine. Right. Okay, guys. Okay, so thanks for listening. Okay, hope this was useful. You can write FMG tests are there. Mock tests are available in the app. Okay, PW Meded app. You can download it and you can write it. Okay, so thanks for listening. Okay, so see you soon. In all the best, guys, for your exams. Okay, so see you soon in next class. Okay, thank you.